Welcome back to my channel. Accurate laboratory diagnosis begins with proper blood sample collection. In this video, we will explore the basics of Vacutainer blood collection tubes, including their color coding and additives. We will also discuss the mechanism of action of common anticoagulants and understand the fundamental difference between serum and plasma. These concepts are essential for ensuring reliable laboratory results and correct interpretation in clinical practice. First, we will start with collection vials. This is a Vacutainer blood collection tube. It's a sterile glass or plastic test tube designed for safe and efficient blood collection. Each tube contains a colored rubber stopper that creates a vacuum seal inside the tube. This vacuum allows a predetermined volume of blood to be drawn automatically when the tube is connected to a needle. The color of the tube cap is not decorative. It indicates the specific additive present inside the vial, such as anticoagulants, clot activators, or preservatives. Choosing the correct tube is essential to ensure accurate laboratory test results and proper sample handling. Now we learn about the different type of Vacutainers. The Vacutainer tubes are identified by the color of the caps, which indicate the type of additive present and the purpose of the sample. The red cap tube is a plain tube with no additives. It is used to obtain the serum and is commonly used for serum biochemistry analysis. We need serum sample to study about the liver function test, kidney function test and all. So if you want to collect the serum, we have to use the red cap. Next is the green cap, which containing sodium, heparin or lithium heparin. These anticoagulants are used for plasma determination in clinical chemistry, such as urea or electrolyte estimation. Next is violet, purple or lavender cap tube, which contain potassium EDTA or ethylene diamine tetraacetic acid. It is primarily used for the complete blood count or CBC, and it is the most common tube that we are using in veterinary practice. Next is a grey cap tube containing sodium fluoride and oxalate. In this, oxalate will act as an anticoagulant while sodium fluoride inhibit the glycolysis, so it will preserve the value of the glucose. So this tube is mainly used for glucose estimation. Next is the light blue cap, which containing around 3.2% of sodium citrate. It is actually a reversible anticoagulant, and these tubes are mainly used for studying about the coagulation. Next is the black one, and which containing around 3.8% sodium citrate and is specifically used for erythrocyte sedimentation rate or ESRs. Correct selection of the Vacutainer tube is essential for accurate laboratory results. Next, the action of these anticoagulants, how they are preventing the clotting. Anticoagulants prevent blood clotting by interfering with different steps of the coagulation cascade. EDTA, oxalate, sodium citrate. It acts by chelating the calcium ion, which are essential cofactor for multiple steps in the coagulation process. By removing calcium, these anticoagulants effectively prevent clot formation. Heparin acts through a different mechanism. It enhances the inhibitory activity of the plasma protein antithrombin, which in turn inactivate several serine proteases of the coagulation system. Most commonly factor 2A or thrombin 10A or 9A. Through these mechanisms, anticoagulants help prevent blood samples in a liquid state for laboratory analysis. This diagram illustrates the difference between the serum and the plasma. On the left is serum. When the blood is collected in a plain tube without anticoagulant, that is the red-capped Vacutainer, then it is allowed to clot. After centrifugation, the liquid portion that remains above the clot is called serum. The serum does not contain any clotting factors because they are consumed during the clotting process. On the right is plasma. The plasma is obtained when blood is collected in a tube containing an anticoagulant, and it is then centrifuged. After centrifugation, the plasma forms the top layer, followed by a thin buffy coat that containing white blood cells and platelets with the RBCs settling at the bottom. Unlike serum, the plasma containing clotting factors including fibrinogen. In summary, serum is plasma minus clotting factors.